We are frequently asked about questions about codeine, and is codeine addictive, and how do you know if you have developed an addiction to codeine or a physical dependence on it. Codeine is an opiate in the same class as heroin, fentanyl, and oxycodone, but it's less potent. That being said, a person who's been using codeine regularly, whether in a product like Tylenol 3 or in certain cough syrups, can still become physically dependent. How can you tell if you're physically dependent? It's going to be most instructive to just stop taking it and see what happens. Some signs of physical dependence might be muscle pain, yawning, sneezing and runny nose, irritability, restlessness and insomnia, diarrhea, chills, goosebumps, things like that. A lot of people told me that they had no idea that they had become dependent on any drug, and it was when they stopped, they just thought they had some kind of a bad flu. In my many years working as a nurse practitioner at the Coleman Institute for Addiction Medicine, I don't really recall ever having a patient come in for an accelerated opiate detox off codeine. I think most people have mild symptoms, as I just described, and then they get past it fairly easily. Of course, that's not the case with other opiates or opioids. We treat many patients who need help getting off that last bit of pain medication, or people who have succumbed to using street drugs, or people who feel that years after being stable on methadone or Suboxone, they're ready to stop. For people who seek help to stop their pain medications, a lot of them have frequently been able to taper their doses of oxycodone or hydrocodone-based pain medication down to anywhere between maybe 35 and 60 milligrams a day. We have certainly helped people get off much, much higher doses than that. But for a lot of people are able to taper down, sometimes with the help of their doctors and sometimes not. But even though this dose isn't that high, most people find it's still too difficult to stop taking without experiencing withdrawal symptoms. So a lot of people that come to us are getting help to get off that last bit of pain medication. And we really try to help take the shame away from this situation. You know, it's not a moral failing that your body has become dependent on these medications, but many people who call us feel so embarrassed that they just can't stop on their own. I often hear from patients that they're so annoyed that they didn't call us a couple years ago because they feel like they don't really need the pain medication, but they just haven't been able to figure out how to stop. And a lot of doctors are not really able to help them stop on their own. Often these are patients who really have a good ongoing relationship with the prescribing doctor, whether it's their primary care provider or pain management doctor. And they would not really fall into the substance use disorder category. They're simply physically dependent. If a prescriber cuts somebody off, however, some people do turn to illicit ways of getting pain medication just to stop themselves from becoming ill, and they find that they're doing things that never in a million years would they have thought that they would do. The International Codification of Diseases Manual, the ICD-10 manual, lists the criteria for somebody who has an opioid use disorder, and this is like a problematic pattern of opioid use leading to clinically significant impairment or distress, and it's manifested by at least two of the following that occur within a 12-month period. So I'm going to just read off these 10 criteria. Number 1, opioids are taken in larger amounts or over a longer period of time than was intended. 2, there is a persistent desire or unsuccessful effort to cut down or control opioid use. 3, a great deal of time is spent in activities to obtain the opioids, use the opioid, or recover from its effects. 4, craving or strong desire or urge to use opioids. 5 is a recurrent opioid use resulting in a failure to fulfill major role obligations at work, school, or home. 6, continued opioid use despite having persistent or recurrent social or interpersonal problems, caused by or exacerbated by the effects of opioids. 7, important social, occupation, or recreational activities are given up or reduced because of the opioid use. 8, recurrent opioid use in situations in which it's physically hazardous. 9, continued opioid use despite knowledge of having a persistent or recurrent physical or psychological problem that's likely to have been caused by or exacerbated by the substance. And 10, developing a tolerance to the medication, which means that you need more of the medication to get the desired effect, or when you're using the same amount, you are feeling some withdrawal. If you are trying to get off pain medication or street medication and would like to have some more information or to see if you're a good fit for our program, please give us a call. We are an outpatient detox center, and we have been specializing in helping people get off pain medication and opioids for well over 25 years. We use long-acting naltrexone after we help people get off the pain medication, and we use a lot of comfort meds to keep it safe, comfortable, and more affordable than going into a hospital setting.